Hello, and thank you for tuning into the program today. Welcome. My name is Neal Howard here on Health Professional Radio. Our guest is Beth Battaglino. She's an RN and CEO of HealthyWomen.org. That's an independent nonprofit health information source for women. And she's joining us here today on the program to talk about what a very recent FDA approval could mean for women's health. Welcome to the program, Beth.
Thanks for having me.
Give our listeners a bit of background about yourself.
Sure. So I'm Beth Battaglino. I head up the leading not-for-profit women's health organization called Healthy Women. We were the first women's website to go live addressing all women's health and wellness information. So we've been in business for more than 30 years, and I'm really excited today to be on your show to talk about the newly approved treatment for women and bacterial vaginosis.
And what is this treatment?
This treatment it's a brand new treatment, and it's a single dose treatment option for women that have bacterial vaginosis. It's a safe, effective antibiotic that they can take, and what's really exciting is that this is the first new treatment in nearly 15 years for treating bacterial vaginosis.
Bacterial vaginosis, is that something that everyone should be familiar with, or is it called something that we're more familiar with, or is it separate from anything that we're aware of as far as women's health?
That's a great question. So bacterial vaginosis, some background, it's the most prevalent gynecological infection in the United States that affects 21 million women ages 14 to 49 annually. And the biggest kind of snafu that women have is when people have bacterial vaginosis, they mistakenly self-diagnose it and diagnose themselves as having yeast infection. So that's where we see a lot of commonality. So they're going to the drugstores and getting over the treatment, over-the-counter medication to treat for yeast infection when in fact it really is bacterial. And so treatment option is completely different than over-the-counter medication. So it takes them a couple tries to figure out what it is. But the way to get the most accurate diagnosis is to go to your healthcare provider and have them test for it. And it's usually a simple swab that they can look at under the microscope, or they may send it out to the lab to get an official diagnosis. And once you get that diagnosis, there's treatment options. And what's so exciting today is that there's a new treatment option that is very safe and effective, and it's a one-dose treatment versus being on an antibiotic for 7 days and taking that antibiotic 2 times a day. As you can imagine, the compliance is not great. For most people, they struggle to even take, for me, I could myself a multivitamin. There you go. You read my mind. Like even taking my multivitamin every day seems to be a struggle for me. So the option of having a safe, effective single dose treatment is exciting. It is exciting to have. Right now we have the antibiotics that I just spoke about orally. You can take it twice a day for 7 days, or you can do a vaginal insert, which can be honestly a little bit messy. So this is exciting when it comes to women's health and new treatment options.
Now, is this newly approved, this FDA-approved treatment, is it oral as well as vaginal? Is that what I'm hearing, or is this totally oral?
It's oral.
Okay.
It's oral. And so right now we have, in the bacterial vaginosis treatment space, we have antibiotics that you can take twice a day for 7 days. Then you have the vaginal insert, which is a little bit messy and cumbersome, and this new approved safe, effective method of a one-dose treatment antibiotic that is almost like a sugar pack. It comes in what reminds me of a sugar packet. So you open it up, and what you can do is mix it with chocolate pudding, applesauce, yogurt, and you eat it, and then that's it. So it's a one-dose treatment. So from a nursing perspective, I'm excited because the compliance is going to be much better. You take it once, and then that's it. And the safe, of course, all the clinical trials they've done, and knowing that it's safe and now FDA approved, it's very exciting.
Now, briefly talk about, we're going to back up and talk about some of the misdiagnosis of women getting over-the-counter treatments for what they mistakenly think is a yeast infection. And you said it takes a couple of times to kind of pinpoint that it's BV. Does this once dose take care of, advanced BV as well as early identified BV? Is that something that is exciting about this new drug as well? Or do you have to double up if your BV is in the advanced stages?
So let's talk about bacterial vaginosis first. So bacterial vaginosis is, you have healthy bacteria and harmful bacteria, just like, in any part of your body. But in your vagina, if it becomes more bad bacteria or harmful bacteria, that's when it can produce bacterial vaginosis. So what the antibiotic will fight off the bad bacteria. What we're finding is from a consumer perspective, there's confusion on the symptoms for bacterial vaginosis versus the symptoms for yeast infection. So for many women, they're thinking that they have a yeast infection instead of bacterial vaginosis, or BV as it's called. So they're going to their pharmacy and getting over-the-counter treatment, thinking that it's a yeast infection when in fact it really is bacterial vaginosis. And the only way that they can get that confirmed diagnosis is through a test that their healthcare provider has to do. And they can do it in their office. Some healthcare providers can do it right in their office, and or they'll have to send a sample to a lab and get that confirmed diagnosis. And once they get the confirmed diagnosis that it is bacterial, then they'll have to go for an antibiotic to treat that. So it's a one dose, no matter when you're diagnosed, whether it's in the beginning, mid, or, a couple weeks out. But the symptoms for bacterial vaginosis are a little bit different from yeast infection. And I think that's going to be, the important thing to highlight right here is many of the common signs and symptoms of bacterial vaginosis include unusual vaginal discharge that can be white or gray and watery. And that bacterial vaginosis has a very, very strong fish-like odor. And it's irritating. So that's, when people come in to see me or other healthcare providers and they say they have a vaginal discharge, but it smells very fishy, right then it kind of piques us pretty sure that it's bacterial vaginosis, and, you're going to have to take an antibiotic to treat that.
So if left untreated, how serious can BV become?
Well, it can, it definitely can become serious. It's not only is it uncomfortable, but it can lead to upping your chances of getting additional sexually transmitted diseases. Bacterial vaginosis is not sexually transmitted. I want to make that crystal clear to your audience. But having said that, having new sex partners or multiple sex partners can certainly upset the balance of bacterial in your vagina, and this places women at a more increased risk for getting bacterial vaginosis. It can also increase your chances of getting other sexual transmitted infections such as chlamydia, gonorrhea, herpes, and HIV. So it is really important to understand the symptoms. And if you have that fish-like smell in your discharge, then it is important to get yourself to a healthcare provider and get a proper diagnosis. And now there's a new treatment option available for it that is a single dose, which is antibiotic, which is very safe and very effective.
And where can we go online and get some more information about this new drug?
For more information, you can log on to healthywomen.org and solosec.com.
Solosec.com and
healthywomen.org.
Great. Thanks for the clarification.
Yeah.
Thanks for coming in. It's been a pleasure. Lots of great information. And I'm hoping that you'll come back and speak with us in some future segments.
Thank you very much for having me.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Been talking with Beth Battaglino. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.